Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the course and branches of the maxillary artery. The maxillary artery is the largest branch of the external carotid artery, and this is also one of the two terminal branches of the external carotid artery. We know that the external carotid artery terminates near the neck of the mandible in the substance of the parotid gland into two branches. One is the maxillary artery, another one is the superficial temporal artery. These two are terminal branches of the external carotid artery, and this is the largest branch of the external carotid artery. It is the major source of blood supply to the nasal cavity, including the paranasal sinuses, lateral wall, and the roof of the oral cavity, all teeth, and dura mater. It also supplies the ear, okay, and also the ganglions like that of the pterygoplatean ganglion, geniculate ganglion, otic ganglion. They also get the blood supply from the maxillary artery. It also supplies a significant part of the dura mater. It passes forward between the neck of the mandible and the sphenomandibular ligament into the infratemporal fossa. This part may pass lateral or medial to the lower head of the lateral pterygoid muscle. That means it may be superficial in most cases, but it may be deep to the lower head of the lateral pterygoid muscle. The maxillary artery ascends obliquely through the infratemporal fossa to enter the pterygopalatine fossa through the pterygomaxillary fissure. It has three parts: mandibular part that is just proximal to the lateral pterygoid muscle, pterygoid part that is covering the pterygoid, the lateral pterygoid. Usually the most part of the inferior head of the lateral pterygoid is covered by the second part of the maxillary artery, and the pterygopalatine part, the last part, that is beyond the lateral pterygoid muscle. So this part is related to the lateral pterygoid muscle. This part is proximal to the lateral pterygoid muscle. This part is after the lateral pterygoid muscle. Okay, we got that. Now we learn the branches of the mandibular part or first part of the maxillary artery. What are the branches? How can you remember? We have a mnemonic. What are the mnemonics for the first part of the mandibular part or first part of the maxillary artery? Okay, our mnemonics is the AIDMA. AIDMA is the psychology of selling, like that of attention, okay, then interest, then the desire, memory, action. Okay, this is the psychology of selling or advertisement. We remember AIDMA. Okay, so just go through that part. A stand for anterior tympanic artery. We'll follow that, the blood vessel here. Okay, inferior alveolar artery number 2. This is the inferior alveolar artery. It enters the mandibular foramen and supplies the lower teeth and comes out as a termination as mental artery. It also provides blood supply to the mylohyoid muscle. Okay, deep auricular branch that has not been shown here. Okay, middle meningeal artery, very important. This is the middle meningeal artery. It enters the cranial cavity through the foramen spinosum. Okay, we have accessory meningeal artery that enters the cranial cavity through the foramen ovale. Okay, it usually supplies the structure in the infratemporal fossa area. Okay, so we got that. Then we'll go to the branches of the second part of the maxillary artery or pterygoid part of the maxillary artery. What are the mnemonics for that? Okay, we'll remember Peter Brown MD. Peter pterygoid branches. So this is the first part. What are the branches of first part? Let us recollect. We have the deep auricular, we have the anterior tympanic, we have the inferior alveolar branch, and we have the middle meningeal artery, accessory meningeal artery. And our mnemonic was aid ma. Okay. Then we'll go to the second part of the maxillary artery. What is the mnemonic? Peter Brown MD. Number one is the pterygoid branches. These are the pterygoid branches. It may be 2, 3, maybe 1 in some individual. Buccal branch that will supply the buccal pad of fat, buccopharyngeal fascia, buccentral muscle, and the mucosa of the oral cavity. So, buccal. Then mesenteric branch that should go through the mandibular notch that will supply the masseter muscle and also supply the temporomandibular joint. Then deep temporal, okay, another branch. This is the deep temporal. Okay, deep temporal artery passes between the temporalis muscle and the bone. Okay, it is underneath the temporalis muscle. Okay, we got that, the deep temporal. Then these are the branches of the second part of the maxillary artery, and our mnemonics is Peter Brown MD. Okay. Then branches of the third or pterygopalatine part of the maxillary artery, our mnemonics: Philadelphia International Airport, passenger departure setup. Okay, let's go there. Philadelphia, P, posterior superior alveolar artery. Here is the posterior superior alveolar artery. Infraorbital, okay, that is the infraorbital. Infraorbital artery supplies the extraocular muscles. Okay, infraorbital artery also supplies the muscle of the teeth of the upper jaw, especially the canine and the incisor teeth. Okay, infraorbital, it also supplies part of the lacrimal apparatus. Okay, we got that. Then we go to the infraorbital. There is the international airport, artery to the pterygoid canal. Here, artery to the pterygoid canal here. Okay. Then number 4, pharyngeal branch. This is the pharyngeal branch. Okay. It should also supply the pharyngotympanic tube or auditory tube or eustachian tube. Then descending palatine artery. Descending palatine artery will be divided into two. One, lesser palatine artery, another is greater palatine artery. Lesser palatine artery will supply the soft palate. Greater palatine artery will supply the hard palate. Then sphenopalatine artery that should go to the pterygopalatine fossa. Okay, and it will be in relation to the pterygopalatine ganglion. It will supply that part. Okay, we got that. So we have mnemonics for the third part, mnemonic for the first part, mnemonic for the second part. For second part, Peter Brown MD. For the third part, Philadelphia International Airport, passenger departure setup. For the first part, we have the mnemonic AIDMA, AID, AID-MA. Okay, we got the mnemonics. And that's all about the anatomy of the maxillary artery. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.